This is part 2 of my video, and in this video I'm just going to give you a detailed description of schizophrenia. The first part of the video I actually gave you the diagnosis and what I thought Nathaniel was suffering from. So I did say that schizophrenia with features of paranoia and hallucinations, as well as delusions. We saw in the movie where Nathaniel was hearing voices, which ultimately caused him to leave school because he couldn't manage. And he was, there was also, like I said, in the first part of the video, there was a point where he thought that he was on the phone with his mom and he was talking. But he, in all actuality, in reality, he was talking to the dial tone. There were times when, well, as far as paranoia, he was paranoid and thought that his sister was trying to poison him. And so each of those things are examples of schizophrenia and some of the symptoms that come along with this particular diagnosis. Schizophrenia, it is most commonly strikes between the ages of 16 and 30. So at the time when Nathaniel had his first psychotic break, which was while he was in college. Of course, that falls between that age range of 16 and 30. And males seem to show symptoms at a slightly younger age than females. And in many cases, the disorder develops slowly. So sometimes it's hard to really figure out what a person is dealing with early on. Sometimes it's not until it's later on. It's not until the mental illness has developed fully that doctors or anyone is able to really recognize what's going on with the patient. Schizophrenia also affects approximately 1% of all adults. Experts say that schizophrenia is probably many mental illnesses masquerading as one. So sometimes schizophrenia can be confused with bipolar. It could also be confused with schizoaffective disorder. It could also be confused with mood disorder. So even when somebody, does have schizophrenia, it could be disguised as a mood disorder. It could be disguised as bipolar. So it's going to be very important that whoever this patient is, or a person, or even Nathaniel in this sense, is going to be very important that he or they see a doctor to really figure out what's going on so that they can be properly treated. The symptoms and the signs of schizophrenia also vary from person to person. So it's not always the same from one person to the next. So just because someone may have delusions, the next person may not have delusions. They just may have hallucinations, or they could have a combination of both, or they could have just paranoia and hallucinations. So it really all depends on the person. You can't really diagnose yourself based on the symptoms that someone else has, because, like I said, it can vary from person to person. Other symptoms of schizophrenia could be lack of motivation. It could be poor expression of emotions. It could be social withdrawal. In the movie, Nathaniel was definitely withdrawn socially. He didn't really participate in a lot of things, and he didn't have a lot of friends. And even to when he was homeless, he really didn't engage with too many people, and interact with too many people. He was a loner. Like I said in my part 1 video, he did a lot of things by himself as a young kid, and that continued as an adult. And he was also unaware of his illness. He knew something was wrong, but he was unaware. And this is another symptom that many people have, and that is, just being unaware of what's going on. And people with schizophrenia also suffer from cognitive difficulties. There are various things that can cause schizophrenia, but nobody knows like that one thing that causes schizophrenia. Experts believe that several factors are generally involved in contributing to the onset of schizophrenia. So, like I said, there isn't specific things that will occur that will, pinpoint that you have schizophrenia. It's a combination of things, but experts haven't been able to, just figure out exactly what that cause is. If there is no history of schizophrenia in your family, then the chances of a person developing that particular mental illness is less than 1%. However, the risk rises to 10% if you have a parent that is diagnosed with schizophrenia. And in the movie, they did not say whether or not Nathaniel's mother or father or anybody in the family suffered from this particular mental illness. So whether it was, something that, was in his genes, we don't know. There could possibly be a chemical imbalance in the brain, which experts believe that an imbalance of dopamine, a neurotransmitter, is involved in the onset of schizophrenia. Other neurotransmitters such as serotonin may also be involved. Again, this isn't definite, so it's very hard to say that always that it's a chemical imbalance. Like I said, these things vary from person to person. So for one person, maybe a chemical imbalance. Another person, it could be an onset of trauma or anything like that. Family relationships, although there's no evidence to prove or even indicate that family relationships may cause schizophrenia, some patients with the illness believe family tension triggers relapses, which a lot of times, even after a patient has been diagnosed with schizophrenia, if they aren't managing stress, and if they aren't managing their medication, then of course when stressful situations come along, it can cause them to relapse, which is why managing this particular mental illness is very important to their recovery. I didn't go over this in the beginning of the video, but how one is diagnosed with schizophrenia. Schizophrenia is diagnosed by observing a person's behavior on a consistent basis. A lot of time this behavior has to be consistent for at least 6 months. If the doctor suspects possible schizophrenia, they will need to know about the patient's medical and psychiatric history. And then certain tests will be ordered to rule out other illnesses and conditions that may trigger schizophrenia-like symptoms. Examples of these tests would be blood tests and imaging studies and psychological evaluations. A lot of times we hear about psychological evaluations, and they do use those to diagnose schizophrenia. The best way to treat schizophrenia is with a combination of things. It's not just one thing, but it is a combination of things. Such as medication, medication management, appointments with a psychiatrist and a counselor, and making sure that that person goes and speaks to someone about their experiences, whether these experiences started from childhood or adulthood, but it's going to be very important that the patient seeks help so that they can treat their symptoms of schizophrenia. Oftentimes, people who are diagnosed with schizophrenia do come off of their meds, so that ends up being a major problem. However, if that is the case, it's very important that that person goes back and get on their meds and, maintain their medication. And of course, continuing to speak with a psychiatrist or a counselor.